Scott, how are you doing today?
Good.
This is my resident Jason. She'll be sitting in on this appointment.
Nice to meet you.
Hey, Jason.
So, Scott, what's going on with you today?
Well, I worked out for a third time today and got dizzy and passed out.
Well, maybe you should work out less.
No.
Yeah, so it looks like I'm looking at your file here, and I see you have type 2 diabetes.
That's when you can't have glucose, right?
Yes, you can't take in glucose in your system. And have you eaten today?
No, I don't eat it today.
Well, excessive exercising and a lack of eating can result in hypoglycemia, which is low blood sugar.
Okay.
Yes, so it is very important to remember to exercise less, eat more frequently, and that way during physical activity, you won't pass out as often.
Okay. Well, I'll remember that next time before I work out.
Please do. I don't want to see you in this office again for the same reason. Hi. Hi, Mr. Derecha.
Hi.
This is my resident Jason.
Hi, nice
Do you
to
mind
meet
if
you.
you sit on the appointment?
Yeah, sure.
So you called in a few days ago about your child Carrie experiencing some symptoms. Do you mind telling me about that?
Yeah. Well, I'm always thirsty and I have to pee a lot. And I've also noticed weight loss and her vision's a little bit off.
Maybe what she needs is a stronger prescription and to drink some more water.
Actually, the symptoms your daughter sounds like she's experiencing relate to type 1 diabetes.
I have diabetes? What does that mean?
Oh, right. Type 1 diabetes. It usually occurs between the ages of 10 and 14, and it occurs when beta cells are destroyed, so the production of insulin is altered. So it causes hyperglycemia, which means high blood sugar.
And what does that mean for my child?
It means that your child will be insulin dependent, and she will have to rely on an insulin pump.
Pump?
But to be sure, we should run some tests.
Okay.
We'll be back shortly.
Come with us.
Okay, so we will contact you within a week when we have the test results. And I'm going to say, good job, sweetie. You did
Thank
such a
you.
good job.
Okay, such a good sport.
Oh, candy.
Oh, diabetes. Right. Wow, I just seen you like a while ago. You're about ready to pop.
What does that mean? I'm only 24 weeks pregnant.
Calm down. We're going to go over your test results from last week.
Okay.
You have gestational diabetes.
Oh, what is that? Is my baby gonna be okay?
Calm down. It's okay. We see this happen all the time in pregnancies.
Really?
Yes, gestational diabetes is caused from an increased production of hormones, and it makes the body less efficient in using insulin.
And what does that mean for my baby?
It increases the chances of macrosomnia for your child, which means that they have a higher risk of becoming obese and developing type 2 diabetes later on in life.
So I should be careful?
Yes.
Now we're going to take some time to go over your sugar levels.
The pancreas, located behind the stomach, is involved in the body's ability to use glucose. In the pancreas, islets of Langerhans secrete hormones into the blood, which are composed of beta cells. Beta cells release insulin after every meal. Insulin, along with glucose, enter the bloodstream and travels throughout the body. Insulin binds to receptors on cells, which opens glucose gates and brings insulin into the cell. In type 1 diabetes, the beta cells can no longer make insulin. In type 2 diabetes, insulin is produced and binds to the cell's receptors, but glucose gates fail to open and prevent the entry of glucose into the cell.